Hello, everyone, and welcome to my very first specialty spotlight episode here on White Coats and Corgis. Most of you probably know me from Instagram or TikTok, where I make helpful free content for pre-meds and talk about my journey as a first-generation medical student. But my mission here on YouTube is to give pre-med students all the important information they need for a career in medicine. And today I'm joined by a very special guest, Dr. Brittany Ladson, who is a first-year emergency medicine resident. Dr. Ladson, thank you so much for taking the time to educate us all about your specialty.
Thank you so much for having me. I'm very, very excited. So I'm a first year emergency medicine intern, and I practice at Covenant and Ascension St. Mary's. And those are the two rotating hospitals for Central Michigan University. I did my undergraduate and medical school training at Michigan State, go green. And I've been a Michigan resident all my life, so it's so great to be a resident in my home state and being able to serve the community that I have grown up in.
That is awesome. Well, my first question that I have is pretty broad, pretty open ended. So feel free to go into as much detail as you want. But what made you decide to choose your specialty?
So for me, I actually went back and forth about a couple of specialties. When I first entered medical school, I thought I wanted to do obstetrics and gynecology. Thankfully, it was my first rotation of clerkship, so third year. And I realized that there's parts that I love, and there's definitely parts that weren't for me. So I loved the labor and delivery unit. I loved being in that procedural area. I liked being one-on-one with people. I really enjoyed the fast pace of it. However, I was not a huge fan of the gynecology aspect. It was more slower. There was clinic work, there was rounding, things that I realized weren't as enjoyable for me. So I kind of took how I felt about that rotation and open it up more broadly to what I could see myself doing for the rest of my life. Especially residency, because it's so hard and so long that if you're not doing something you absolutely love, it will probably feel like torture. So for me, I definitely like the diversity of procedures and being hands-on and being in acute situations. So I thought, what's better than emergency medicine? That was my third rotation of medical school, and I definitely fell in love with it almost immediately. At that point in my career, I had not really been in the emergency room setting. I didn't scribe as an ER scribe. I didn't volunteer in the emergency department. So that was really my first longer term exposure to emergency medicine. And there was nothing about it that I disliked. I liked every part of it. I liked the diversity of even when you get to work. So it's not always 8 to 5. It's sometimes you're working at 11:30 p.m. until 7 a.m. and you get to work with such great people. The teams are just so robust. You have your RTs, your respiratory therapists, your nursing team, you have your techs, you have the paramedics, you have your residents and attendings, and it's just so collaborative that it's really inspiring work. I love to see a team work together so well and then reach outcomes like getting a person back, getting ROSC, getting them intubated, and then up to the ICU. There is like nothing more satisfying than that. So it was with those experiences and those team interactions, and then just the diversity of the medicine. Like you're working with things from urinary tract infections all the way up to septic shock. So it is so cool. I couldn't imagine myself doing anything different. And so I'm just so excited that I am blessed enough to be an emergency medicine resident.
Wow, that is amazing. That sounds really, really great. One of the things that people ask me all the time is like, what is your favorite part of what you do? And I know you mentioned a lot of really good things, but to you, what is the best part to you?
For me, I definitely love the collaboration. Um, when you get the call from EMS on the radio saying that there's something really cool coming in, a level one trauma, or there is a really obtunded patient coming in that you know you're gonna have to intubate, like you almost get really jittery and excited. And you get all your gear on, you get your PPE ready, you get all your equipment ready, and just like the anxiety, the anticipation of what's going to happen is so much fun. And then actually getting to get the patient through the doors and starting to do those things is just so cool. So my first few weeks of residency was really my first time getting to be the go-to person for a lot of procedures. So there was a lot of learning involved, and of course, with learning comes failure, and that can come frustration. But now that I'm like 12 weeks into residency, I'm starting to get the hang on things. And so it's becoming even more exciting when those things come through the door, knowing that I have some amount of skill that can be used to help resuscitate the patient.
That's awesome. Yeah, emergency medicine sounds really, really exciting. But on the flip side, is there anything that you haven't enjoyed thus far?
So with the excitement, absolutely comes some downfalls. Some patients, whether they intend to or not, can be very agitated or physically or verbally aggressive. Um, I always like to keep in mind that a lot of times their disease process has them behaving that way, whether that's a psychiatric illness or that's hypoxia making them agitated, or a whole host of other things that can make them agitated. Even if it's an older individual who can't express that he needs to have a bowel movement and he becomes agitated and is trying to get out of bed and kind of aggravating the staff. So that can be a lot to work through, especially when you have family there at bedside with the patient and having to work through all those things at the same time. It can definitely be a lot, but as time goes on, I'm learning how to be that person that has those conversations with patients and their family members when things get a little bit more aggressive. And as time goes on, I'm sure I'm going to get better at it. And so hopefully those things that make me a little bit nervous will become more commonplace as time goes on.
Absolutely. And I mean, you've come so far in your journey compared to me. At this point, I'm only a first year medical student. So, something that I think a lot of pre-meds and younger medical students like myself wonder is kind of what you did throughout your journey to get to the place where you are now. So, would you mind telling us a little bit about your journey kind of from pre-med to now a doctor?
So in pre-med, I went to Michigan State. I knew I wanted to do pre-medicine as my major almost at the beginning of high school. I definitely wasn't someone who knew I wanted to do medicine for my entire life. My whole family's finance and accounting and business, so I thought I should as well. It sounds like it's in my DNA, so I should do it. But I realized after an internship that it really wasn't for me, so I knew I wanted to do some type of science or pre-medicine when I entered college. In college, I did a lot of research, which I thought really helped my application and helped me build a network of people to ask for like letters of recommendation and for just networking in general and being like a professional in general. Um, I love to present at conferences and love to give talks, whether that be about the research itself or other things in general. I think as time goes on, I get less nervous about speaking in public forums, which is a good thing, but it's definitely something I've been very conscious about, knowing that if I do this, I will get better at it. And then I also was a teaching assistant for a biology class in a biology lab, which I really enjoyed because a lot of the students were only like a year or two below me in school, and a lot of these people ended up being classmates in medical school. So they were just a year or two behind me, and so they will definitely be my future colleagues. And so it's cool that I got to interact with them so early on in both of our educations. And then I also volunteered at the hospital. I was in what they called the falls prevention unit, and we are just a group of volunteers who went around to people's rooms making sure that if they were a fall risk, they had their red socks on and had their bed alarm on and things that would indicate to the healthcare team that they were at risk of fall if they got out of bed. And so it was like pretty chill work, but I think the biggest blessing that came out of that was I met a physician who I ended up shadowing for several years through that volunteer work. She was a really great doc, had a really approachable demeanor about her. And so while I was volunteering one day, I went up to her and I was like, "Hey, you seem super nice. You seem really great with patients. I would love to shadow you, learn more from you. You're also an osteopathic physician, which is what I want to do. So I want to learn more about that." And she was super receptive to it. And that ended up being like a 2.5 year shadowing opportunity for me. So it was really, really great. What came out of just, that volunteer at the hospital for 2 hours one week or every week. And that's pretty much how my pre-med education went. I ended up applying to medical school at Michigan State, and I definitely knew I wanted to go there because I had done so much work, like volunteer work and interactions with the medical school already. So I knew how just great they were, how great the education team was. And I have seen so many physicians graduate from the program that I knew that they create a very high quality physician that I would want to become one day. So I ended up applying, and thank goodness I got in. And once medical school started, it was definitely an adjustment period. I felt like in undergrad, I was much more on top of things, always prepared, ahead of the eight ball. But in medical school, it's very hard to be ahead. It's very hard to even be like where you're supposed to be at in terms of getting all your studying done, all the lectures done, getting all your things checked off your to-do list. And still to this day, it is very difficult to do that. Um, so during medical school, in order to kind of gear my application towards emergency medicine, once I knew I wanted to do that, I got involved with my Michigan College of Emergency Physicians chapter and went to their conferences. And that allowed me to obviously like show my face, show that I'm interested in emergency medicine here in Michigan, and then also meet programs, learn what programs are available in Michigan, what their curriculum looks like. There are still 3 and 4 year programs here in Michigan. So I wanted to figure out if a 3 or 4 year program was better for me. And then also just to network with other pre-med, pre-emergency physicians, and just get to know them and get to know what they're doing in their application. And obviously just making connections because we are going to be colleagues one day. And then one other thing that I did to prepare my application for residency was I also delivered a TED Talk, which was a super great opportunity for me. Just another way to push myself and talk in public and have like a super important platform. And my topic was about STEMinism, which is women in STEM, specifically in medicine, and just the experiences that we have that are different than our male colleagues. And also just my thoughts and hopes for when I become a wife in medicine and a mother in medicine, what that's going to look like, and who my mentors and advisors will be during that time in my life. And then, of course, just trying to share that I want to be a role model for other young women who are pursuing medicine, whether you are first generation, whether you are non traditional, whether you are anything or everything, just inspiring the next generation of female physicians in whatever specialty they want to pursue. Um, and That's kind of where that got me today. Um, and now I'm here. I matched at Central Michigan, and I'm super excited to be now in my third month, finishing up my third month of residency. And it's been definitely, ups and downs. Life doesn't stop once you're in residency, so you still have to deal with um all of your life stuff, moving, animals, home stuff, all while dealing with residency, which is definitely a caliber above medical school. So just trying to survive as I can, trying to enjoy the journey because I'm sure when I look back, I will hope that I will have. Um, and that's where I'm at today.
Wow, well, that is such an incredible journey. I had no idea that you had a TED Talk. I will definitely be linking that in the description so everybody can go and check
Awesome.
that out. But yeah, that is super interesting. So you mentioned now that you're a first year intern. What is a typical day like for you? You mentioned it was very challenging. Could you describe some of those challenges for us?
So for me, um, every day looks a little bit different. In medical or in residency, we still have different rotations that we're on. So we have um like right now I'm on my ICU rotation. We also have like OB-GYN, we have orthopedics, we have neurosurgery, neurotrauma. But of course the main priority is that we have our emergency medicine rotation. And so a normal emergency medicine day, normally we work 8 or 9 hours. It does depend on, we have two different hospitals that we rotate at. So one does an 8 hour shift and the other hospital does a 9 hour shift. So typically before shift, I just got to get ready. I got to get my scrubs together. And then a lot of times physicians will tell us the night before to kind of review a topic that we were supposed to learn about the previous day. We saw a patient that related to that topic, um, and to come prepared to talk about that the next day. And so trying to get that prepared, get lunch together as well, get some snacks. Because in the emergency room, we love our Diet Cokes and we love our energy drinks. So getting that all assembled, ready to go for the day, getting all amped up. And then we have our 8-hour shift. Typically, we see as an intern 1 patient per hour. So we end up seeing approximately 8 patients during one shift. They can be all the way from just getting sutures removed, sutures placed, all the way up to traumas and God knows what else. And after that, we normally do a little debrief, just how the day went, any feedback we have, anything we need to improve for the next day, any topics that we're supposed to review to chat about the next day, and then go home, get a shower in, and repeat the next day. And then also throughout our week, we have a 5-hour block of weekly didactics. All residency programs have this, and ours is on Thursday mornings. So that is a dedicated time block where you are in no way required to go to your rotation. And we are just there to have 5 hours of lecture and discussion about emergency medicine topics, getting prepared for step 3 or our emergency medicine boards. And also throughout this whole process, there's other things added on. For instance, we have to take ACLS, which is Advanced Cardiovascular Life Support. We also take ATLS, which is Advanced Trauma Life Support. And then I'm currently, as we speak today, doing what's called FCCS, which is Fundamental Critical Care Medicine. And it's another course that we are required to take in order to graduate residency in the end. There also is step 3 or level 3, depending on if you're an MD or DO, that you still have to take during your first, I think it's like 20 months of residency. So kind of like a year and a couple of months into residency. So that's my next thing I have to get taken care of. So there's plenty of studying for other purposes that's kind of thrown in either before or after a shift.
Got it. Yeah, that does sound very busy. That's your life kind of as a resident now. Do you foresee it changing in any way once you become an attending?
So that is definitely something I'm trying to think about as time goes on. I definitely know that I want to be a mother one day, and I still want to practice medicine as much as I can. So I'm thinking about when that time comes that I may want to do more academic medicine. So maybe work within a residency program or within the actual emergency medicine department of a hospital. So having some academic type shifts and admin roles, and then also working in the emergency room. Just because in the ER, you're definitely at risk of catching any bugs that people come in with. It's very hard on your body to be intubating, putting central lines in, flipping yourself in all weird types of positions to help patients out. And as a pregnant person, I can imagine, I can only imagine at this point that that could be potentially an issue. And so I want to set myself up for success and have kind of like a hybrid career on my way.
Wow, that's very interesting that you can do that. Are there different directions that people go in once they become an attending in this field?
So, excuse me. Um, Specifically in emergency medicine, I do think that's somewhat common. Once people kind of hit their second or third decade of practicing medicine, they sometimes will go into like Botox injections or like pain clinics, or some will even do like a fellowship in sports medicine or a fellowship in palliative care. So having that additional training kind of keeps, hours more normalized, keeping but still working nonetheless. I don't see myself quite doing that as much as doing more academic or administration type of stuff. Um, but I would say in emergency medicine, it's more common than probably any other specialty to do something like that. A lot of people in other specialties will typically work in their field until they retire.
Interesting. Yeah, that's very cool. My next question, as you know, a medical student, I think this is on a lot of our minds, is kind of the competitiveness of the specialty and how difficult it is to match into residency. Could you speak a little bit to your experience going through the match?
Yeah, so my match was the second year that it was completely virtual. So we didn't have to fly to any of the residency programs to do the interview and tour. It was all on Zoom, which has its pros and cons, of course. You save a whole bunch of money doing that. You save a whole bunch of time, but you don't really get the true feel of the program by doing that. And really, you only get that feel when you do a full month of audition at that program. Um, and in general, emergency is pretty much in the middle of the competitiveness scale. Definitely not as hard as something like dermatology or general surgery, but a little bit more competitive than family medicine or pediatrics or internal medicine. Of course, getting into residency at all is a challenge, and getting in is an absolute congratulatory event. It's not easy by any means. Um, so emergency kind of lands in the middle. And although this year there was kind of an interesting shift in applications and acceptance, in that there were fewer people accepted into residency because there were fewer people that applied to emergency medicine residency. And it's really the first year that that's happened. And there were actually a lot of EM seats in the country left open that were not filled at all. I really don't know, and I really can't speak to whether I think that will happen again in following years. Um, I hope it doesn't. I hope that emergency medicine continues to be a really strong and competitive specialty that people want to apply into. But I really don't know if that's a combination of more seats being available versus maybe something to do with the COVID pandemic and not wanting to do emergency because it's very hard work. I really don't know. So definitely an interesting year to be an EM match candidate. But it's definitely just as important to be as professional as possible during Zoom meetings. They are still long, they're like 4 or 5 hours of different Zoom breakout group interviews. And sometimes some programs like to do kind of like a virtual tour of their hospital, but it is hard because they have to abide by HIPAA, so they can't just grab their phone and start videoing the whole emergency department because there's patients all over. But they definitely try their best to show you what the hospital is like and what the emergency room looks like. But again, with it being virtual, it's pretty tricky.
Got it. The last question that I had for you is what advice would you give to any medical student who is thinking about trying to match into emergency medicine?
Yes, if you're thinking about applying emergency, great job. You've applied to the best specialty there is. And you're in for just a great treat of a residency. Um, and my advice would be definitely don't compare yourself to others. There's no linear track into emergency medicine or any specialty at all. And just be you, be authentic, and give it all you've got because you want it to be a one shot into residency if you can make that happen. Um, and have fun, enjoy the journey if you can, because you will look back and be like, dang, it was so much easier back then, or maybe there was a little bit less stress back then, or now the amplitude is so much higher nowadays. There's more responsibility, and you're relied upon much more as an intern and then in subsequent years. So really just enjoy it and give it all you've got.
That is awesome. Well, thank you so much. We really appreciate it.
Awesome. Thank you so much for having me.